Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today I'm joined by Dr. Susan Quaggin, who is the president of the American Society of Nephrology. How are you today?
I'm great, and thank you very much, Jared, for inviting me on today.
Absolutely. I'm really excited to speak with you. And for those of the audience that are watching, I love that blazer you have right now.
Oh, thank you.
Is that pink or salmon?
It is pink, and yes, I figured something colorful would be appropriate.
I like it. It's perfect with like the beige chair behind you too. You win the award for probably like best looking like office I've seen or backdrop. That design. Everyone, I'm going to tell everyone that's listening to the podcast they must go on and watch the video just so they can see this blazer and your background because it is really nice. Probably the cleanest background too, by the way. So kudos to you.
All right, thanks.
Well,
I do have
now that
a
I'm
kidney.
well, now that I'm done gushing over the blazer and the background, let's talk a little bit about you. Would love to hear about your background and then your current role at ASN.
Sure. Well, thanks for asking. So I am a nephrologist. I'm a kidney doctor. Actually a Canadian, but I live in Chicago now for the past 9 years, where I'm the chief of nephrology and also run a research lab and research institute. And my passion is working to improve and transform kidney health. So I'm really excited and privileged to serve as the president of ASN this year and last year. And there I work with a phenomenal group of staff, as well as a large number of member volunteers who, are all our focus to advancing kidney health. So it's really an exciting place and an exciting time for kidney health.
Absolutely. And as I was talking to you a little bit before we started recording the interview, I was super excited to have you on also for the reason of like how my experience with nephrologists, my family's experience with nephrologists, because my grandfather went through dialysis for several years. So I was super excited to have the opportunity to speak with like he would have been he would have been very impressed that I was speaking with you right now. So I'm so happy to have this opportunity. So I appreciate you giving us that background. I would love to shift focus if it's okay and hearing more about ASN. Maybe tell us about the mission and then some new initiatives underway, if you don't mind.
Sure. Yeah. So ASN, it's a professional membership organization. So it's an international organization of about 21,000 members in over 130 countries. And as I mentioned, the focus is on advancing kidney health. So a few years ago, we revisited the vision and the mission statement and came up with a pretty bold vision, imagining a world without kidney diseases. And, that is bold because there are 850 million people worldwide with kidney disease. And in the United States alone, 37 million. And you've even, personally in your own family experienced it. And, about 90% of people with kidney disease don't know they have it. So, the time is really ripe that we change that. So I also appreciate you asking about new initiatives. So a couple of years ago, we developed uh, a new United for Kidney Health initiative. You can join, anyone can join. You just go to the American Society of Nephrology website. You can join it for free. But the purpose of United for Kidney Health is to bring in members not only from within ASN, but from other walks of life, patients, other individuals who also, will join us in this real fight against kidney disease. And there are four pillars to United for Kidney Health. One is to intervene earlier, and that's to prevent kidney disease and kidney failure like your grandfather had. One is to transform transplant. So we're in a new time for transplantation. You might have heard about xenotransplantation and all sorts of new initiatives around helping patients. Another is to eliminate disparities, and kidney disease is really a poster child of disparities. So that's front and foremost in everything we do. And finally, certainly not least, but stating it last, is innovation and enhancing patient choice. And in everything we do, our guiding principle is to do what's in the best interest of people living with kidney disease.
That sounds
I
like
just
a
said a lot. I just
no.
said a
Hey,
mouthful.
no, it was a good a lot. That's a pretty cool new initiative. Can you share maybe some of the thought process and why you wanted to roll that out?
Yeah. So, I think it goes back to the point that, kidney disease is a huge problem and yet it's under recognized. And it's time, that we stood up for kidney patients, and it's time that people took notice. So, the initiative itself is pretty bold, and it focuses on areas that are really undergoing transformation right now in our field. So, as I mentioned, we're at an incredibly exciting point in the kidney space. Incredible new therapies that are powerful, that can, almost stop kidney disease in its tracks, but certainly slow down progression. So the time was right to do this. And, I think with a lot of interest and enthusiasm from younger generations, which I'm so excited about. Activism with optimism to really make a change. So that it's the right time, and I think we're all behind it, and it's an exciting opportunity.
Absolutely. Yeah, I'm excited that you rolled it out. I'm going to look more into that as well. And if, when we release this, if you want me to put any links to it or anything, please just
Sure.
tell the team and we'll put those in there in the show notes or comment section. Leading into that, which I think this new initiative that you launched kind of leads into my next question, was really around what the society is doing. The American Society of Nephrology uh, is doing to help create a world without kidney disease. And I know that initiative kind of plays into that. But can you tell us what else you're doing in order to help that become a reality?
Yeah, so you might imagine there's lots of activity going on. And again, this really comes down to having phenomenal staff at ASN who are committed to advancing kidney health. So major functions of ASN are in education, so educating the membership, and they do that through international meetings that are held every year, through webinars, through special learning modules, lots of innovative teaching. Throughout COVID, they really led a charge to network globally and to educate not only professional members but also patient groups. In addition, we've got a lot going on in the policy space. So we've got incredible individuals who work with the society who are leveraging, policy, legislative efforts to make sure they are all in the best interests of patients with kidney disease. So that's a lot of time spent up on the Hill and talking with individuals in DC and around the country. We also partner on larger global policy issues and education with international societies like the International Society of Nephrology, the European Renal Association, and that was important with recent efforts with the Ukrainian war and trying to get, you know, um, the proper resources out to patients and kidney patients who are, suffering over there, and research. So ASN gives out millions of dollars in research grants every year. We've got a pipeline of the next generation, which is incredibly exciting because they're the ones who are going to make the next, big discoveries, as well as a lot of initiatives around excellence in patient care. And here, there's a lot of partnership with patient organizations like AAKP, as well as with FDA to try to advance new treatments and new therapies, like you were talking about earlier before we got on, with your grandfather. And, throughout all of this, we partner a lot with patients. And one other initiative that's pretty cool is something called Kidney X, and it's a private-public partnership with HHS, with the government, and it's a prize competition to develop bioartificial kidneys, xenotransplantation, new therapies. So yeah, lots and lots of activity, and members who are participating in all sorts of challenges to help raise awareness, as well.
Thank you
I
so
keep
much.
talking a lot.
No, you're not. You're talking the perfect amount, and you're answering each one of these questions incredibly. So thank you. I know sometimes it feels right. I always want to give you as much time as you need to answer questions. So you're doing a great job. I have a couple more things I'd like to dive into if that's okay.
Sure.
Uh, this is another area I'm super interested. Obviously, given my background with or experience with having a loved one kind of go be a part of kidney disease. Uh, what kind of treatments are currently available to help slow or stop the progression of kidney disease today?
Yeah, so that's a great question, and one of the reasons why we're so excited about this time in kidney medicine. Over the past few years, there's been a slew of very positive clinical trials that demonstrate you can slow the progression of kidney disease. You can slow sort of the progression to kidney failure, ending up on dialysis or needing a transplant by a huge amount of time, in over a short period of time. So, some of these therapies are known as SGLT2 inhibitors, which were originally developed for patients with diabetic kidney disease, but now it's been demonstrated that it works for chronic kidney disease without diabetes. And there are a number of other new therapies that have come down the pipe. So, we could go on probably for an hour, but the opportunity now is that we really do have these powerful new therapies. The biggest issue right now is implementation, making sure that physicians and other members of the healthcare team know how to prescribe them. That patients are, partners in choosing these medicines, and that we get the costs down in this country. So there's still cost barriers, but it really is going to transform the way we manage kidney disease. So incredibly exciting time, and it really aligns with that first intervene earlier, of our first United for Kidney Health, because now we've got the tools, we can do it.
So going off of
Yeah,
that, at what point should a nephrologist step in during treatment
yeah.
for someone that has kidney disease?
Right. That's a great question. And usually it's towards the later stages of kidney disease. And we need to partner as nephrologists. Some of our best professional partners are the primary care physicians. And we need to have a really good dialogue so that we know, when a patient needs to come to see a kidney specialist. However, with these newer therapies, we really need champions in our field to get out there and to help our primary care physicians, really learn that they need to start prescribing these early, maybe before we start to see these patients. And in addition, we need a lot more research dollars, national and international research dollars, to be able to identify and better risk stratify patients really early, and identify who's going to go on to develop more aggressive kidney disease, so that we can really focus on that population of patients. So I think it's a great question. And I would say that everybody should know their kidney health risk. And there are some great tools with our partners at National Kidney Foundation. Pop onto their website as well, and you can just fill out, it's like maybe a 1 minute survey that's electronic, and you'll know if you're part of the 1 in 3 people at risk of kidney disease.
Well, thank you so much, by the way, for coming on and answering all my questions and telling us more about ASN and your background. Really appreciate it. Look forward to already having you come back again soon, maybe on one of our other podcasts sometime as well. But thank you so much.
Well, Jared, thank you so much. And I'm sure I talk too much. I'm passionate about kidney health. So I really appreciate you giving us a platform. Thanks so much.